And we welcome a special guest to the desk with us right now from Broadlawns Medical Center. Dr. Scott Monham is joining us, and we are talking prevention here this morning, aren't we?
Yes, I wanted to emphasize prevention today because so often I think patients go to their doctor when they're ill, and I want to stress the importance of seeing the doctor when you're well, and that in order to prevent disease, many times it just starts with paying attention to some of the bad habits we have and knowing some of the guidelines that we can follow to try to diagnose things earlier. So that's what I really want to emphasize
So maintenance
today.
is better than trying to correct what is wrong.
Exactly. I think that so often we can intervene before the disease starts, and that's really where we ought to put our emphasis.
And there are some tests that are recommended at certain ages in life that should be done, so you can kind of do some of that preventative
Exactly,
maintenance, so to speak.
Exactly. So dependent upon your age, you may be eligible for any number of preventive health services, and we recommend that you see your doctor to discuss those.
Okay, what's some in particular that you want to talk about?
Well, today I brought a few things that I wanted to talk about relative to colonoscopy, and that's just one option available for colon cancer screening. So colon cancer itself is one of the leading causes of cancer amongst those in the U.S., and it's the third most common cancer. In fact, it is the second leading cause of cancer death in the U.S., and so we have many screening options available, and those screening options can save lives. About 50,000 people this year will die of colon cancer, and screening itself may reduce that by at least half.
Wow. And this is almost completely preventable, isn't it, if you get screened?
Yes, that's correct. Colon cancer is like a prototypical disease where if there is early detection and treatment, that can certainly impact the outcome and lead to a curable cancer. Definitely.
Now you have a couple of different ways. You have one that's very uninvasive, which you have in the envelope here. What is that one? How does this one work?
So this is a fecal occult blood test that can be used as an option for cancer screening.
Hold this up here so we can see
it. The nice thing about that is that it's non-invasive.
Jason would use it. That's the reason they have biohazard on it. Jason would use it. Okay, so what has to happen here?
So a specimen can be collected in the comfort of a patient's own home, and that can then be mailed into the company that processes the test. So it's convenient, it's less invasive, definitely, but it does have limitation. The value of this type of a test is that it can help detect cancer earlier in hopes that it'll result in a cure. Whereas,
so what do you have to do with this whole test then?
Basically, there's a list of instructions in here, and you have to collect a stool specimen. In this little...
So you just poop on a stick?
Well,
okay.
Actually, it's on a piece of paper that goes over the toilet.
Oh, really?
And then there's a brush in here that you can use to collect the stool specimen, and then you send that in.
Okay.
Yep.
Fair enough.
Now, if you get a positive test there, does that lead to the next step then?
That's correct. So anytime this test turns positive, then this is the next step to look for a source of the bleeding.
Now this looks unreal.
I hope you cleaned that before you brought it in, Doc.
Oh,
it looks like you should be wearing a Roto-Rooter suit or something, because look at this, and it has numbers on here, and here's what I'm determining. The doctors who perform these type of procedures, they get points for how far they can stick this, because it's 20, 30, 40. They accumulate more points as further they go in, like a video game.
Well, I was going to say, this is the new kind of version of video game, isn't it, Doc?
Okay.
So what is this contraption?
So this is a colonoscope, and doctors who do these are measured in terms of their quality, but it's not in the distance that it's inserted. So basically, this device here, when used for colonoscopy, has the ability to navigate the inside of the colon, and it can directly visualize and detect polyps or cancers. And therefore, this can be a preventative tool if the polyp is removed before it becomes a cancer, whereas this is more of a detection tool. Let's detect cancer early and treat it at a stage when it can be cured.
Now, is that how I got these pictures? Because we had a colonoscopy on the air here. I'm not sure you realize that.
I heard that.
Yeah, we had a colonoscopy. Now, is that where we got these pictures here?
Yes, that's correct.
That's how these pictures were taken with this device?
Exactly.
Okay.
And then if you find a polyp,
breakfast eating.
how do you remove it? Is that a different instrument then?
So through the working channel of this scope, there's a small opening.
Okay.
And it's through that opening that an instrument called a snare can be deployed, and that snare can
Lasso it?
encircle or lasso the polyp, and therefore it can be removed.
Really?
That's how you do that?
And then do you
So-
just cauterize it and?
Yes, cautery electrical current can be applied to that, and then there's actually a suction port here too, so the polyp can be sucked through the scope
Are you
and into a
serious?
collection container.
Okay.
Can you show us? I mean, does it work if you maneuver it with your devices over there? Just kind of see what
Sure.
different things it can do.
So it moves in all directions, up and down, left and right.
That is amazing.
And then the endoscopist can also make directional control just by torquing the instrument
Okay.
at the same time.
That's-
Were you good at video games when you were younger?
You know, one of the largest trophies I received when I was a kid was actually for playing in a Nintendo tournament.
See that?
So I took second place at this tournament for playing Mario Brothers.
See that? How about that? And coming up later on today, speaking of
great.
Mario Brothers, we have the Hall of Fame, the Video Game Hall of Fame. We're going to tell you who the first inductees are. Coming up a little bit.
Excellent,
And
excellent.
But the important message, obviously, is preventative medicine, and it may seem invasive, but you've been through it. It's really not that big a deal.
that you worry more about it
Yeah.
than you do with the actual procedure, because when the procedure is done, you say, was that it?
Mm-hmm.
The hardest part was
It's
getting ready for
the
it.
prep, yeah.
Yeah, the hardest part was the prep. Now, have we changed having to drink a gallon of that stuff nowadays or not?
You know, there are various colon preps that you can take before colonoscopy. The one that's most studied is the Go Lightly prep, which is 4 liters, a gallon, and that is a large volume. So there is one option that is about half that volume, and it involves using polyethylene glycol, a brand name for that is Miralax, combined with Gatorade, another brand name. But a lot of patients like that as an alternative because it's less volume and easier to swallow.
Okay.
Okay, there you
So
go.
there's some options out
But
there.
really, don't be afraid of it. And what age are we talking? We
Exactly.
should have this done.
You're right, it's nothing to fear. And it's recommended that all adults ages 50 to 75 have routine colon cancer screening.
And what's
that's for an
routine mean?
average risk adult.
Routine, how often?
So one option for routine cancer screening is a colonoscopy. And if everything is normal, then 10-year intervals.
Oh, okay.
If a person decides not to do a colonoscopy, then fecal occult blood testing can occur on a yearly basis.
Okay.
And then there are other various tests that are used alternative to that, such as flexible sigmoidoscopy or barium enema.
But make sure and get with your doctor and talk with
Exactly.
them and get something established before something happens.
Exactly. About 1/3 of adults within that age group have not had colon cancer screening, and I want to change that and send a message that, you know, there is certainly value in seeing your doctor when you are well to try to prevent disease.
Wonderful. That's
Thank
a
you
great
very
message
much.
this morning. Thank
So,
you.
yeah. Yep, you're
And
welcome.
if they want to get more information, what
Yeah,
should they do?
so I work at the Family Health Center at Broadlawns, and we're happy to see you. Our telephone number is 515-282-2334, and we're happy to see you and discuss these things.
Go check it out. Thank you, doctor. Thank you for
Thank
being
you.
here.
Thank you,
Thank you
doctor.
so